So what do orthopedic surgeons do? We see patients with musculoskeletal problems. You've got a sore neck, you've got a sore back, you've got a sore hip or knee or ankle. You stepped in a hole and twisted your ankle or your knee. Today I had a lady who was a diabetic and who broke her ankle, and so we had to go in and line her ankle back up and fix it with plates and screws. And the idea is basically just to stabilize the fracture so that the fracture can heal in a normal position. When you see an orthopedic surgeon, the most important thing is letting them know where you're hurting, what caused it to hurt, what makes it better, what makes it worse. Once we know those things, we can usually figure out a way to get you better. And we always try to figure out what's the best treatment for you. Our care is always individualized to the patient. We're trying to figure out what would make you have the best outcome possible. And that may be different from you versus your friend. Each person may have different medical issues that change how we treat you. Each person may have different desires. So most patients that we see in the office, we're going to get better without even getting to the point of thinking about surgery. So what do orthopedic surgeons typically see in the office? A lot of times we'll see arthritis, especially of the hip, the knee, shoulder, and the ankles. We'll have a lot of patients that have pain in their shoulder, and anytime somebody's got pain in their shoulder, the big thing is trying to figure out, is it the shoulder that's hurting or is it the neck making the shoulder hurt? And a lot of times we can tell that based on physical exam. A lot of times we'll need to get an x-ray. Sometimes if it's coming from the neck, we'll need an MRI scan. One of the other things that we do is we see people that have herniated disc in their neck or in their back. A lot of times, in addition to therapy, we can even do injections for patients that have a pinched nerve in their back. And a lot of times that can help the patient avoid having to have a big surgery on their back. And so a lot of times we'll do that. And I work with my spine surgery subspecialist, Dr. Capel, to help come up with a treatment plan for you regarding that. Now, there'll be some patients, though, that continue to have trouble. Like, for instance, if somebody comes in with a shoulder problem, a lot of times we will start them on an anti-inflammatory. We might give them an injection and then get them set up with physical therapy. If they continue to have trouble, then the next step usually is to get an MRI scan. And if we get an MRI scan and we see something like a partial tear or something like that, we can still try to manage the patient conservatively and only do surgery if it's the last resort. However, if you go to therapy and you have injections, we do anti-inflammatories and you're still hurting, then at that point, that's usually when we'll talk about having surgery. My name is Dr. Lloyd Johnson. I'm an orthopedic surgeon here at Alabama Bone and Joint. If you have any questions, please call us, come in and see me, and I'll be glad to take care of you. We have offices in Pelham, Clanton, and also in Centerville at Bibb County.